I do want to say before we get started that any opinions expressed in this video are my own and not of my employer. And as always, these are just opinions and they are not facts, and we cannot trust everything that we read on the internet. So as the truth comes to light, we will update our knowledge. So just keep that in mind while you're watching and enjoy the video. Hello everyone and welcome back to my channel. I am not in my normal setting today because I was laying in bed. I've just come off the shifts, I just got home, and I was thinking about whether or not I was going to discuss this breaking news story on this channel or if I was going to just see how it plays out. But I decided to come on and just share what's going on. So today I'm talking about a hospital in Columbus. Comes about because a doctor named Dr. William Husel was giving an excessive amount of a very strong painkiller to multiple patients, which subsequently resulted in their death. And so I'm going to be reading from my cell phone the news story from the Columbus Dispatch, and I also have a timeline so we can kind of look and see how he was functioning and how he was prescribing and what was happening during this time. So this doctor, Dr. Husel, is an ICU doctor, and he's been with Mount Carmel for about 5 years, and he was known for giving emergency doses of very strong narcotics, one of which was fentanyl. And even if you don't work in healthcare, you probably know just from the extreme heroin epidemic in this country that fentanyl is a very strong medication. The story is that he would prescribe these as emergency doses, which then would bypass the need for the pharmacist to approve them and allow the nurse to pull them out of the Pyxis. So in total, they are investigating 34 of his patients that were over-medicated and then subsequently died, and there have been 14 wrongful death cases filed against him at this time, and he has been fired from Mount Carmel, and the head pharmacist, or the director of the pharmacy, she has been fired as well, and then multiple nurses and pharmacists have been put on administrative leave. So when a patient's in the ICU, they are generally very sick, and they can be on ventilators or have, lots of other equipment and a lot of machines. And it's very frightening for the patient and also families. And since they are in an acute state, it's a lot more likely that these patients will probably die. There's a lot higher rate of death in the ICU versus like a regular floor. So perhaps initially it wasn't a cause for concern. I don't know the whole story, of course, I wasn't there, but this is what I'm gathering from multiple news stories. You cannot believe everything that you read online, so we'll have to take all of this with a grain of salt, and as more things develop, then we can go from there. So he would prescribe oftentimes 1,000 micrograms of fentanyl. I cannot even comprehend that much fentanyl, considering they come in 50 milligram vials. So you literally opened 20 of these vials and you didn't think that that was a cause for concern? You might wonder why a doctor would prescribe such a high dose in the first place. It's said in this Dispatch article that there were times that families were really stressing about whether or not they should take their family member off the ventilator, relinquish life support from them, and they were concerned maybe that are they going to be in pain, or and all the concerns you might have when you're deciding to withdraw supportive care and from a patient, from your family member. So it's said in this article that he would tell the families that he was going to control their suffering so they wouldn't feel any pain with this medication, whatever. But he didn't mention that it was a huge overdose and it would definitely kill them. He left that part out. So there's speculation that perhaps he's trying to be an angel of mercy. Maybe he, knows his patient is suffering and wants to try to help them, pass over to the other side or whatever more peacefully. Okay, we'll call you an angel of mercy for now. Or maybe he is just has a weird, sick obsession and he enjoys doing this or there's a other side that maybe it was sort of a, physician assisted suicide type of thing, which is not for just the physician to decide. It is illegal in a few states. I know it's legal in Washington, Oregon, and Vermont. And this is more of something where the patient has a horrible prognosis and they are suffering every day in extreme amounts of pain, and they are ready to, move on from this life. They don't want to suffer anymore. And they call upon this physician to help them by giving them a strong amount of medication to overdose them and send them on, but they're not feeling any pain. This is still a very controversial thing, but the reason that this does not apply to him is because you have to have given consent, first off. So if the patient's on a ventilator, possibly sedated, or in such a state of illness to where they are not awake, then they could not have possibly consented to this. Besides the fact that it's not legal in Ohio, legalities aside, it's not able to be discussed with the patient at length. So even if you were trying to do that, you are not doing that because it's illegal and you didn't consent with the patient whom you are overdosing. So I don't see that as a potential possibility. So you might wonder how this happened not once, not twice, but 34 times throughout his 5 years with Mount Carmel. You might wonder, did no one question this? Did no one think to say, this seems like too high of a dose? Why are we doing this? And I'll tell you that, according to this article, if he was challenged in any way by nurses or pharmacists about this excessive dose, he basically threw his weight around and said, well, I'm the doctor, for one, which is not a good enough answer. He would also say that he did his residency at the Cleveland Clinic, which is the number 2 hospital in the country, and so that he knows what he's doing. Also, not a acceptable answer. And if those two things didn't convince you, the fact that you have some initials behind your name and that you got to study at Cleveland Clinic, or if those two things aren't enough for you, then he would give very lengthy medical explanations and basically go on and on until whomever just said, okay, fine, and be done. Hindsight is 20/20. So you can look back on nearly everything you've ever done and said, yep, I could probably have done that better. Or something like that. I think we all can. So I am passing no judgments on any nurses that gave these medications. But when I ever question a doctor, and granted, I am still, considered a new nurse. I've only been a nurse for 8 months at this point. So the likelihood that I'm going to hardcore question a physician is not great. And there is a point where I have to trust what you're telling me. I have to trust that you are right when I ask you if this is correct. I have to trust you because I cannot possibly know everything. It's the conundrum of a new nurse because you're supposed to question everything. And everything is your fault when shit goes down. It's always our fault when something goes down. But if you have to open more than I'll say more than 3 small vials of anything. If you have to open more than 3 of anything, you have to be saying to yourself, what am I doing? This, how is this a proper dose? What is, and it's not like it's not known that fentanyl is an extremely strong drug. It's not like that's not known. Everybody knows that. It's unfortunate because a lot of these nurses are probably going to have, if they don't lose their license, they'll definitely probably have marks against them. A lot of them are going to have to go to court in all these cases, in all these lawsuits. So they're going to have a tough road ahead of them, and it's unfortunate. But at the end of the day, it's always the nurse's fault. So you got to answer for what you did. You agreed to give the medication. And even if it was something that I had felt so strongly about that I would not give, and I would just, Adam, this is too much, I'm not doing it. I will say, here's your 20 vials, and here's your syringe, you go do it. And it's easy for me to say that sitting here, not being face to face with this doctor, I don't know how he treated the nurses, whether he screamed at them or whether he was nice to them. And so they said, okay, well, you maybe you're so nice to me, I guess I'll just, I'm understanding. I have no knowledge of how he is as a person or anything. This is just my speculation, it's just my opinion, but perhaps they were persuaded to do this, or maybe they felt bad for the patient and wanted to bring them some mercy in their final days. Perhaps they were, greatly suffering and they wanted to ease their suffering. I can understand wanting to ease a patient's pain because I feel like, especially in an ICU setting, it can be very difficult to just stare at a patient looking at all the things they're hooked up to, all the drips, all the machines, all the stuff, and behind all the stuff that's hooked up to them, there is still a person in there. So I can only imagine how difficult it is to look at somebody who is on their deathbed and just suffering away. So I don't know any of these people's stories. Unfortunately, 34 families were affected by this man who was being reckless. The article goes on to say that the Mount Carmel health system had the first formal complaint about Dr. Husel was filed in late October of 2018. An internal investigation was started, and they put out statements on how they were, increasing safety standards and how the previous standards were not sufficient and that they will, upgrade them, make them better. Okay. It also states that they're going to make changes on the amount of medication that can be pulled in an emergency override. Yeah, you shouldn't be able to pull 20 vials. What Pyxis has 20 vials of anything? Let alone a medication like that. So yeah, maybe you shouldn't be able to pull 20 at a time. That's just me. I don't know, but whatever. So Mount Carmel officially fired Dr. Husel on December 5th, 2018, and he is being investigated for all these 34 deaths. The hospital believes that although all of the patients died, perhaps 6 of them were not caused by a fentanyl overdose. So did one of their other comorbidities get them first before the fentanyl did? I don't know what that's about. So all of these patients except for one were at Mount Carmel West and one was at Mount Carmel St. Anne's. Along with the director of the pharmacy was being fired. The hospital's vice president of medical affairs was placed on administrative leave. Wonder if he's still getting a paycheck. So a total of 23 employees, including nurses and pharmacists, were placed on leave regarding all of this issue. So how did he get past this undetected for so long? Well, a lot of these patients were a lot older. So, especially being in an ICU setting and you're a lot older, things happen and then you pass away. It's unfortunate, but when you're old, maybe you don't, have an autopsy because they were 85, they lived a good life. We know they were going downhill, whatever it was, we don't need an autopsy. So Dr. Husel was able to get away with a lot of this for so long because the Mount Carmel health system restructured how their physician residents were working. So they were not allowed to work more than 80 hours a week, which sounds insane. Whatever. So a lot of them didn't do overnight on-call hospitalist shifts, So he was oftentimes the only ICU doc in the ICU at night, which is when a lot of this happened. So when you set something up as an emergency medication, if you order it that way, then it's bypassed by the pharmacist, so they don't have the chance to approve it before it's, able to be pulled out by the Pyxis. So it was pretty much overriding the pharmacist, being able to pull out of the Pyxis, go from there, but the pharmacist still has to approve it, but they just have to do it retroactively. So what happens if the pharmacist doesn't approve it? I don't know that. That's an excellent question. But apparently lots of pharmacists were bullied into, agreeing with it. Maybe they got the same spiel that he did. I'm a doctor. I went to Cleveland Clinic. I did all this. Well, so out of all of his patients whom he did this to, only one of them had an autopsy performed. And the findings of this autopsy, the coroner listed that the cause of death was cocaine and fentanyl. So I don't know where the cocaine came from. I think we know where the fentanyl came from. But I don't know what he was admitted for or why he was in the ICU, but among the excessive amount of fentanyl, he also liked to give 10 milligrams of Dilaudid and 2 10-milligram doses of a sedative known as Versed. And we talked about Versed recently, it's an anti-anxiety, but just like any benzodiazepine, excessive amount will cause an overdose. So even though this mighty doctor had a residency through the Cleveland Clinic, he was not technically board certified, which you still can practice as a physician and not be board certified, but most physicians are. And according to this article, it's an estimated that 85% of physicians working in the U.S. are board certified in whatever field they are in. So it was unusual that he wasn't, but not everybody is. It's not a requirement. That doesn't speak to his character or his medical ability. Being board certified just serves that you have an extensive amount of expertise in that particular area, but it's, again, not a requirement to be able to practice. So let's go through the timeline of what happened to these people and how it all came about. So we're going to start way back in 2008. So from 2008 to 2013, Dr. Husel was completing his residency through the Cleveland Clinic. In 2013, he moved down to Columbus and started working within the Mount Carmel health system. And he had 2 uneventful years until March 1st, 2015, a 65-year-old woman died. May 4th, 2015, an 85-year-old woman died. Now, their names are listed in this article, but I'm choosing not to read them. So after this 85-year-old woman, on May 10th, a 69-year-old woman was dead, and then he was laid off for 2016 and most of 2017 until a 55-year-old man died October 9th, 2017, and in the same day, a 63-year-old woman also died. December 10th, 2017, a 70-year-old man died. December 11th, a 79-year-old woman died. April 1st of 2018, a man died. There was no age given. July 15th, a 44-year-old man died. May 28th, 2018, a 44-year-old man died. September 30th, 2018, a 64-year-old woman died. October 24th, 2018, a 39-year-old man died. So the very next day after this, October 25th, Mount Carmel has received the first formal complaint concerning him. And they received another formal complaint November 18th of that year, and that same day, a 75-year-old woman is dead. November 20th, another woman is dead. And her death is what prompted the hospital's investigation. So the first two complaints were not prompting enough, I suppose, but then when another person finally died, that was prompting enough. So, okay. And the very next day, November 21st, the hospital receives a third report concerning Dr. Husel, and he was removed from patient care. And between this time that he was removed, the time that they received the report and then he was removed from patient care, 3 more of his patients died, and they don't give names or ages on these ones at this time. Okay. On December 5th of last year, they fired Dr. Husel without any public announcement, and at least 20 nurses and pharmacists were removed from patient care. At this time, Mount Carmel does its due diligence, notifies the state medical board, and discusses it with the Franklin County prosecutor. They also notified the boards of pharmacy and nursing on December 7th, and December 11th, they implemented new training protocols for the staff. In the end of December 2018, the hospital starts to reach out to the families of the patients of Dr. Husel who had died from excessive doses of fentanyl. January 14th, a patient's family files a wrongful death suit, and this is of this year, 2019, and the CEO of Mount Carmel on this very same day releases a video statement about the physician's firing. Mid-January, the hospital distributes updated medication guidelines. January 15th, another wrongful death suit is filed. January 16th, another one. And then again in January 2019, the Ohio Department of Health launches an investigation about the hospital on behalf of the Medicare and Medicaid services. So this is putting their Medicare and Medicaid payouts in jeopardy. Another wrongful death suit is filed January 22nd. And on that same day, Husel meets with the state medical board to have an investigative conference. On January 24th, the hospital announces that it's identified 7 more patients that were given excessive doses, which brings the total to 34. On that very same day, the state medical board revoked the doctor's license to practice medicine. On January 25th, 2 more lawsuits were filed against the doctor and the hospital, so now the total is 6. The Ohio Medical Board suspends his osteopathic medicine and surgical license, and they are starting to launch a formal agreement, and the Medicaid board suspended his provider agreement, so he can no longer be reimbursed by Medicaid. January 28th, 2 more suits are filed. January 29th, all these 23 employees are placed on administrative leave. January 31st, another suit is filed. February 1st, Medicare and Medicaid puts Mount Carmel in immediate jeopardy. February 5th, 3 more suits are filed, so now there's 12 against him. And this is when they fired the chief of pharmacy, the pharmacy director. And February 7th, the 13th and the 14th lawsuits are filed against the hospital and Dr. Husel. So now that we know the timeline, it seems that this happened quite frequently, even if there was some, time in between. Maybe they went a year without anything happening, but at the same time, there was some cases where it was 4 days in a row where that something happened. So unfortunately, all of these families are negatively affected by this happening, and now perhaps they're feeling some guilt about believing this physician and trusting him. Maybe they did the wrong thing. It is unknown, and it'll have to be investigated, and this will be a very long process. I will try to keep you up to date as more things come to light, but at this time they are well into their investigation. He is suspended with his medical license, and so what does this teach us from a nursing standpoint? What it teaches us is that if you think that something is not right and you don't want to give it and harm the patient, harm yourself, lose your license, go to jail, it is not outside of our realm of practice to say no. We are allowed to say no to physicians. We are allowed to say, no, I'm not doing that, and this is why. Now, we can't just say that for just anything. No, I didn't really want to give her 6 a.m. Protox because I don't really feel like waking her up. That's not okay. We can't do that. But if they order 10 milligrams of Dilaudid, you can say, well, I don't think that's an appropriate dose, and if the physician doesn't agree and still wants you to give it, you can very easily hand him the syringe and the vial and say, go right ahead. And that's not outside of our practice, scope of practice. So keep that in mind when you see something that is unusual come across your desk. And thank you so much for watching. I will keep you guys updated on this story. Please leave a comment down below if you have any concerns or questions, or you want to have a discussion, and I will see you in the next one. Bye.